Good afternoon. Today we have an interesting topic. I've had patients not too infrequently ask me, should I wait until after I've had children to have a breast augmentation? Now, we could go through a lot of up and down and around the bush about yes or no, but in my opinion, the answer is no. You should not wait until you've had children to have a breast augmentation, because the opportunity may never present itself. And meanwhile, time is passing you by. A breast augmentation is about self-image and quality of life. And delayed gratification has its place, but women are going to enjoy a breast augmentation much more in their earlier decades of life than they will in their later decades of life. As a matter of fact, as time goes on and as you get older, depending on the specifics of your breast augmentation, you may want, to have a change, or you may want them to be removed. So it's probably a better idea to go ahead and enjoy your life, enjoy your body, enjoy your physical appearance with a breast augmentation sooner rather than later. A breast augmentation is not going to be adversely affected by pregnancy. Now, what I will say is, pregnancy does affect the shape and volume and position even of your breast, the first pregnancy. Once that has occurred, those breasts are not going to change a whole lot with subsequent pregnancies. In other words, before pregnancy, your breasts are full, you might be a little bit saggy, you have what I consider or describe as baby fat in those breasts. You get pregnant, you breastfeed, the volume of the breast decreases, the skin envelope from the pregnancy has been expanded, and now that has shrunk a little bit, but not all the way. So now you may have a mismatch between the volume of the breast gland itself and the size of the skin envelope which contains it, and your breast may be saggy. So a breast augmentation in a situation like that can be expected to be a fairly stable result. You may or may not need to have a breast lift. And subsequent pregnancies after that are not going to significantly change the way that breast looks. So it's not a liability to have an implant and have pregnancies. You can breastfeed without worrying too much. Whether it's a saline implant or a silicone gel implant, there is no data to suggest that there's any potential harm to a baby. A breast augmentation is not going to adversely affect your ability to breastfeed. A woman's capacity to breastfeed varies from one pregnancy to the next, so nobody can ever really predict how successful or for how long, or whether or not the child will even cooperate. So a breast augmentation certainly can be done at any time relative to childbearing. Another aspect of childbearing and breast augmentation I want to talk about is, I think it's really important for your surgeon to be included in a discussion of what your plans might be in that regard, because I think that it matters what type of implant, meaning smooth versus a textured surface. I think it matters where that implant is placed, meaning on top of the pectoralis muscle or underneath the muscle. And I think it also matters where the incision is made through which you place the implant in the breast, whether it's around the border of the areola. The areola is not this high, but I'm just drawing so you can see, or whether it's underneath in the breast fold. So my personal viewpoint is, if you're using a breast implant that's textured, it tends to stay in position a little bit better, so that if you do have a subsequent pregnancy after the breast augmentation, the implant is going to tend to stay in position a little bit better. Now, the breast skin and the breast itself will, of course, go through that inevitable enlargement that is a key part of pregnancy, and then shrink afterwards. But it's usually not going to be so sufficient that it's problematic. But I think it can be problematic if you have a round, smooth implant on top of the muscle, and that thing is causing you to have more sagginess. Another point I want to make is that is to come back once again and touch on the fact that life goes on, and we're put here to enjoy our lives. And if you live long enough, your breasts are going to age along with the rest of you. So if you live old enough to be a grandmother, then you may have breasts that look like granny breasts. And that's irrespective of whether or not you've had children. If you've had children and you're, up in age, your breasts are going to tend to be a little saggier anyway. So the breasts change, they evolve as we do. And as you get older, they may need to be lifted, just like your eyelids may need to be lifted, or you may want them lifted. Your face, you may want to have lifted. Your arms. I mean, so it's really a matter of enjoying yourself, body image, and quality of life. So I hope that this has been a helpful discussion for you. If you want to have a breast augmentation, go for it. The childbearing and whatever changes that go on in your breast after childbearing remains to be seen, but it will certainly not be anything that can't be handled with you and a competent plastic surgeon. Thank you.